Dr. Marth Whyte, Regional Director, State Department of Health. Hey, Dr. Martha, welcome back to Keel. How you doing this morning?
I'm doing all right. How are y'all?
Well, evidently there's going to be lots of new testing available. Aaron says, and Walmart is involved. Fill us in on this. I don't know the details. Help us out.
So this testing site is a replica of a testing site that Walmart did in Chicago. It's going to be open first for symptomatic first responders, which includes, healthcare workers, fire, police, EMS, as well as nursing home attendants and that kind of thing, as well as people 65 and older and who are symptomatic. It's a Quest is assisting them with this, and they have an app that you can go online and register. So you go, as long as you go before 11:59 the night before to their website and register, you can pick a time to go be tested. It is for symptomatic people, and the goal is to eventually open it up wider, but that's where they're starting.
When are they opening it? Do you know?
They're opening like a soft opening tomorrow. Today, and then they'll open fully tomorrow.
And this is the Walmart in Shreve City, correct?
That's correct.
Okay.
And it'll run today. I think it's going to run from like 12 to 4, and tomorrow it'll run from, the rest of the days it'll be 10 to 4.
And it's drive-through only, and how quick will the responses be back?
We're pushing for three days.
Okay.
How are those tests done? Obviously, I'm not going to stick my arm through a drive-through window like at Wendy's. How exactly, so they can draw blood? What's the plan here?
Oh, it's not a blood test. So what you do is you register your time. When you get there, they cue you into your time slot line. It's really interesting. It's got so organized. And then as it's your time, you pull up, and they actually put a swab in your nose. It goes pretty far up your nose, but it's not painful because it's really tiny. And then they put it in a tube which has some fluid in it, and put the top on and send it off to be run.
Pardon me just a second, just to clarify. I'm behind the steering wheel. I drive up to the window. I lean in, and somebody inserts a stick up. How exactly is this?
Window.
Help me out here. Help me out. Oh, so there's somebody
going to walk up to you.
Somebody standing there.
Yes.
And going to put put a stick halfway up into my brain. This is perhaps I exaggerate just a smidge.
I'm sorry, Martha.
I'm just trying to look. I'm in the target demo here. Okay, I'm trying to figure this out. I'm over 65, so I'm trying to figure this out.
You're no symptoms.
So it and the whole thing takes how long?
To have the test?
Yes, ma'am.
Oh, just seconds.
Okay.
I've had it done twice. It doesn't hurt. It's just a little bit uncomfortable because someone's putting a little tiny
See, you're a woman, though. You're used to pain. It's women, just they handle pain better than, well, me.
You're still negative now?
I am.
Okay.
Yeah. He tested me twice.
Let me ask you, we talked to Dave Langston yesterday, and he was talking, oddly enough, and I know you want to talk about this, that for him to donate his plasma, he had to go be tested again, and he was fine, but another friend of his still had some residuals. At what point are you considered well and you can go out among people, maybe even go back to work?
So his friend is still considered well. What they believe is because the test looks for RNA, we talk about DNA. Well, RNA is kind of what we call reverse nucleic acid. Long story, but anyways, they think that hangs around a little bit long, and so some people may have a residual positive even though they're not infectious. He has no symptoms. He's fine. He's totally able to work. You can go back to work. Now, this is really important because people aren't always getting the right message. You can go back to work. You have to have had a minimum of 7 days from your first symptom. So the day you get sick, 7 days out at least, and you have to have 3 days with no fever, with no medicine. So that can be 3 days within the 7 days or 3 days outside of the 7 days. Does that make sense?
Yeah, I get that. Now, for people that are not even tested, but maybe running a fever, and they're like, I don't want to waste a test. I'll just get through this. Are there a lot of those folks out there?
I think so. I think people are afraid of cost, and I want everyone to know that these tests should be not a cost to you. When I went and got tested and through the drive-through I went in, they weren't asking even for insurance information. So there is a way, I think, for them to get reimbursed, but it should not cost you anything. So if you feel like you need to be tested, there are ways for you to get tested. Please don't be afraid. A lot of people feel like, well, I'm pretty sure I have it. I'm just going to stay home. That's okay too. That's okay too. Just know that you've got to really watch yourself for your symptoms. If you get short of breath, and I'm going to tell you from my husband, it happened really quickly. It was even to me who does critical care in my past, it was frightening to see. So if you get short of breath where you're having trouble catching your breath or you feel like you can't get good breath in, you need to go to the ER.
How's your husband doing now?
Or you call 911.
How's your husband doing now?
He's still critical, but he is stable as much as you can say with all of his interventions, but they are making a difference because he was declining every day, and so now he's stable every day for the last few days, so I'm thankful for that.
Let me ask you one more question. The numbers that the governor is showing now, showing that 70% of the people who have died are African Americans. It's raising a lot of alarms about, the access to health care and pre-existing conditions. In looking at the numbers, what have you noticed with that in mind?
So let's just be honest. This disparity has been going on for decades in our state. It's not something that people have ignored. It's something that people are trying to address. Something we've been working on in our region locally with a lot of leaders. African Americans have a lot of risk for those pre-existing conditions that make them at risk for greater disease. There are a lot of people in all of our community who are wary of healthcare. They're wary of the cost. They're afraid. And so what we want to make sure people understand is we're going to take care of you. If you need help, you need to seek help. Don't sit at home and suffer and not try to get care because you're afraid of cost or whatever reason. We need you to take care of yourself. We need you to let us take care of you. And, that this is something that's definitely been brought to the forefront with this disease, and hopefully it'll push forward change that a lot of people have been working for.